Basically, what we do is tobacco control advocacy, and we start from prevention. Now, prevention is to help young people understand the ill effects of tobacco use through our school-based programs and our community programs. We help. Basically, presently, I've written a book authored by me. I have the copy, which actually helps young people to understand the health effects of smoking. And so it's in a bid to prevent them from the uptake of smoking. That's for prevention. Now we're talking about protection. Protection is about policies, trying to work with governments and to enact policies that protect the rights of non-smokers, you and I, from breathing public place smoking and smoker, which also affects the non-smoker. Also talking about cessation. Cessation is the third part of it. That's what the programs that help smokers to quit. Smokers who intend to quit, that's what we say. Yeah, some of them, maybe sometimes they're tired of what you're doing and they already know the health effects, and sometimes they want to quit. So we offer support through quit systems. It could be NROTs, nicotine replacement therapies. It could be through artificial cigarettes, which helps them gradually withdraw from smoking cigarettes and all of that. So that's what we do basically. We try to collaborate with organizations across borders, both locally and internationally, and that's how we can reduce the scourge of tobacco smoking. Okay. Tobacco actually causes more than 5 million deaths every year worldwide.
So what kind of progress are you making on cessation particularly?
Okay, particularly on cessation, we have not really been so much into cessation. We've been most focused on prevention. But right now we're coming up with ideas as much as possible to get collaborators that can work with us in cessation. We have been able to request a sample artificial cigarettes, which helps smokers to cut down on their smoking from the US. We got a sample, and we're looking for collaborators as much as possible that can help us get them down to Nigeria, because we understand that a lot of smokers want to quit, but due to addiction from nicotine, and sometimes they don't have the help and support, they're not able to quit. So we believe that if we get them, inform them, and get the systems available in Nigeria, I think that will help a lot.
Tell me about the importance of working with young women.
Okay.
Smoking.
Yeah. Okay. Right now, the tobacco companies, we call them big tobacco, particularly British Group, American Tobacco, which has a big manufacturing factory in Nigeria, actually targets young people, including women, making cigarette looking stylish. They make it look feminine or masculine, as the case may be. So there's this attraction, and it makes you feel as if when you smoke, you're cool. But we try to make them understand the ill effects of smoking. It's not about starting the smoking now, trying to feel good or feel cool. We're thinking about the effect it has on you in the future. Most smokers lose or they actually die or get affected by tobacco smoking in the productive middle age. It doesn't start now. From 35 to 69, when you're supposed to be productive to the society, to any government, to any environment, they begin to lose potency, they begin to lose workforce and all that. So women particularly, because women are important in society. Without women, children cannot come forth. That's why there's a study I put up, the poster I'm presenting here in this conference is about the risk of breast cancer among women who start smoking as teenagers. Now I will talk about teenage, because at the early age, the systems are still developing. That's when they're just going into their menstrual cycle or whatever, and see as the system is developing, and cancer has potent carcinogens, tobacco smoke has potent carcinogens that affects those systems. So when they start early, they get affected as they smoke and in a period of 20 years, it affects them a lot. So that's why we came up with this study. I'm very proud to present this. And most times when I go to conferences, I'm sometimes the only tobacco control person around there, and it makes me proud. But it's a challenge to me also to be able to pass the message across to people. It make great awareness about this issue. People just think smoking is a thing not to talk about. It's just a thing. It's a thing that it has been. It continues to be. But if nobody's doing something about it, I don't think it's nice enough. It's good somebody takes up a challenge and work to change the situation.